We need to have a bigger conversation about expertise, evidence, accountability, like in this social media era. Because one thing I noticed is that many audiences cannot distinguish between clinical opinion, personal opinion, spiritual guidance, motivational speaking, and evidence based mental health practice. Those are not the same, right? Those are not the same thing. And this is important to talk about. And it's really timely because May is mental health awareness, y'all. And as someone trained as a scientist practitioner, I'm expected to ground my work in research, ethics, theory, assessment, peer-reviewed evidence, continuing education, and clinical standards of care. That doesn't mean clinicians know everything. We don't. It does not mean that research is perfect, and it does not mean systems are flawless. But it does mean that there are frameworks of accountability behind what we say and do, right? And I think that, what concerns me when I hear broad statements minimizing licensure, ethical standards, or evidence-based practice while simultaneously speaking with the authority of a mental health expert, that makes me nervous, right? Like, that's dangerous because audiences are not going to realize the difference between this sounds powerful and this is clinically supported. A compelling testimony is not the same thing as evidence. A viral clip, that's not the same thing as competence. Biblical references, personal stories, charisma, confidence, emotional intensity, that may resonate deeply with people, but resonance alone doesn't make something clinically sound or ethically appropriate. And this matters because mental health professionals, we're not just influencers. We're working with vulnerable populations, people in crisis, people navigating trauma, people dealing with suicidality, abuse, psychosis, grief, attachment wounds, and severe mental illness. And that responsibility requires more than having a platform or being relatable. It requires accountability to ethical codes, standards of practice, continuing education, supervision, consultation, and evidence-based care. Even though I'm licensed, even though I technically don't have a supervisor anymore, I still have to answer to somebody. And honestly, one of my biggest concerns about social media, mental health culture right now is that many people want authority. People want the authority associated with being a therapist without wanting the accountability attached to being one.